What's up, YouTube? It's your boy GP's on the keys, and it's too easy video today. And I wanted to learn how this. I was looking at the NHS, and I kind of have a blanket knowledge of like a blanket understanding of what the NHS is. Literally the opposite of the United States. And I kind of wanted to learn more about this. So we're gonna look at this video. This is how the United Kingdom's healthcare system works, and it's all. I want to talk a few minutes, maybe a few minutes, but I'll put a timestamp. You already know I always put a timestamp. Every time it's almost a political type video, I just have to talk. It's always a conversation about, we need to change the healthcare system. We need to change the healthcare system. When it's not going to work, the healthcare system is never going to change. Because think about it, 2020, the year when the pandemic literally changed the world as a whole, Big Pharma still made $400 billion in 2020. $400 billion. $400 billion. So you really think they would give up $400 billion to make healthcare public? And the fact that there's people in America that think that having the right to healthcare is far left. It's socialism. It's socialism. Yes, while you sit in your you sit in your multi-million-dollar mansion in the most just suburban suburb in the world. Because I'm telling you, man, when they make these decisions, they don't consider the middle class or the poor. They don't consider the middle class or the poor. They don't. And it's a thing that a lot of people be trying to, that's what I kind of get weird with conservatives about. I'm like, my thing is, being a conservative really don't work for you unless you got some money. It really doesn't work unless you got some money. Because, bro, the poor and the average man they're not being thought about when they make stuff like this. Healthcare for everyone is socialism, but yet you got people who are still conservatives, but was on Obamacare, and was still conservatives, and was still poor enough, still couldn't afford medical bills, was going into huge amounts of debt because of medical bills. But giving people a right to healthcare is socialism. It's far left. Oh my God, it's a socialist idea that everyone has basic human rights. I'd rather wait a couple months. I'd rather wait for a doctor than go bankrupt because I can't pay for my treatment. If we're being all the way honest, it doesn't make sense. They don't think about the poor people. They don't think about them because this world is about, it's a class thing. I keep telling people race matters somewhat, but it's more about class, man. It's more about class. The more money you have, the more pull you have in the society. I keep saying this, bro. Race is like just a small little rung on the ladder, just something else that they try to use to distract us even more from what's really the problem is class. It's not about race. It's really not. It's never been about race. I mean, it was back then, but once all this money started getting them, once technology came and all these super high tech stuff, it's about class. The rich versus the poor, the elite versus the really poor people. But let me just get into this because I want to see how this works.
Super Tuesday came and went, and the Democratic presidential race is narrowing to two very different candidates. Far-left Bernie Sanders and the more moderate Joe Biden.
I knew damn well Bernie wasn't going to win anyway. Because, bro, he's talking about all this free stuff. This is the stuff I knew he wasn't going to win anyway. And the thing is, Joe Biden is from my state. I mean, Joe Biden's from Delaware. That's my state. And I still just
Biden and Sanders have clashed on the best approach to reforming U.S. healthcare. Sanders wants to get rid of private insurance altogether, while Biden proposes building on the framework left over from Barack Obama's Affordable Care Act.
Bernie says that you have to bring people together, and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to tell us what the damn thing's going to cost. The idea middle-class taxes aren't going to go up is just crazy.
What Medicare for all will do it saved the average American substantial sums of money.
The U.S. already spends...
And the fact that people disagree with that is unbelievable. The fact that you don't think that people should have a right to not have to worry about debt when they go to a hospital. It's literally people that will drive themselves to the hospital when they get in a medical emergency because they don't want to pay for the ambulance to take them to the hospital. But yet it's people saying something's wrong with that. Don't worry about what it's going to cost. Yeah, because it's going to tax the rich people. Because the rich people are going to get taxed more. Oh my God. But the welfare of everyone else doesn't matter to you, apparently. Like, you see what I'm saying? You see how selfish that is? Oh, we're going to get taxed more. Ugh. See how selfish that is? That's extremely selfish. It's going to cost the country so much money. Like, y'all can't print money anyway. Y'all make money. Y'all already make all the currency. Like, talking about it's going to cost more. Just print more money. That's really how it is. If the United States can determine how much their money costs, what's wrong with printing more money? If you can determine how much this dollar bill is worth just because you put a U.S. mint stamp on it, then you can obviously print more money. Like, bro, it's all about greed. It's literally all about greed.
More money on healthcare than any other developed country. There's one country that spends less than half what the U.S. does on healthcare, and people generally don't pay anything out of pocket when they go to the doctor. The United Kingdom. And out of all the healthcare systems we've looked at, the UK appears the most socialist. The government effectively runs the whole thing. Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms?
A lot better, I'll tell you that.
In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000.
$10,000 per person. That's ridiculous.
US dollars. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US. And the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare.
But yeah, healthcare for all is socialist policy. It's far left. It's socialism. How much will it cost? How much will it cost us when our life expectancy keeps dwindling every year? Oh my God. The
infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a risk-sharing system, so everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So,
it's like they'll take a portion out of your check or something like that to sponsor the NHS. Okay, so it's like a social security tax then.
In a sense, it's not free because it's paid out of taxation.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increase to pay for sorting the NHS out in terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as
True.
the first step.
Yes, the big
I would call that
corporations.
socialized medicine. Government provides the care. Government pays for the care. It's paid for through taxes. Everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football,
What's wrong with that?
especially in the United States.
What's wrong with that, though?
The NHS, if that's socialised medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialised medicine, we like it, and most people are still very, very supportive of the concept of a national health service.
Each of the UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly between them, but all of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs.
Yeah.
But those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they do in the US.
Dog, I got a story, bro. Like, I literally had to, when I you know how, like, when you a kid, you eat a whole bunch of candy and you gotta get fillings, right? So I go and get dental work, and I come to find out, my insurance only covers half of my dental work. So I gotta still pay. I pay like $250 for one filling. I got one filling done that day. I had to pay $250 out of pocket, even though my insurance kicked in. So $500 for one tooth, for one filling. Imagine how much a root canal would be. It's people who is not getting surgery and they're not getting operations done because they can't afford their medical bills. Like, come on, bro.
Unlike with other universal healthcare systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service.
That's what I always
Many
wonder,
GPs
like, how are they getting
negotiate
paid?
contracts with the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
The private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's Niall Gardner. He's the director of the Thatcher Centre for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare.
But it's like an option to get private healthcare. I understand.
Not least because there are long waiting lists.
Like, that's cool. Like, I'm cool with an option to get private healthcare. Like, if you have the money, cool. But it shouldn't be that the only option is private healthcare. You know what I'm saying? Like, it shouldn't be the only option for people. Because everyone doesn't have thousands of dollars to drop on these surgical operations that they need. And the fact that people going into debt, wages getting garnished, stuff getting repoed because they put overdraft in your bank account because you don't have the medical expenses to pay right now. Like,
with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector, and the NHS has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff, it takes it from the NHS. It cherry picks, takes the low risk patients, not the high risk patients. It has an impact on training NHS staff, which is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved. And unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit media discourse, with the Leave campaign famously claiming that the UK would take back £350 million a week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of
But my thing is, where is this money going if it's not going to the NHS?
official statistics.
My name is Holly Jarman. I'm an assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol.
EU?
It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals. The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. So NHS or anything else, or a lot more than that.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade
deal.
A lot of trade negotiations are actually...
I'm sick of these super rich people trying to speak for the average person. Like, you don't even know. You'll never have a problem paying for medical services. You'll never have to worry about not having the money to pay for anything. You need to think about the people that are struggling and can't pay this. Oh, we're going to private. We see that people in America are struggling to pay their medical bills. You know what? Let's bring this over to the UK and have the same problem just so we can siphon more money out of the people.
Quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal. That the UK government's preferences have been shown to be largely economic and not so much on the focusing on the health of people in Britain.
The problem is that the NHS is already on the table, and it has been for a while. The politicians who are now going to be negotiating the trade deals, it's going to be across many fronts. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in a trade deal, then let's see legislation that sets that out so it's cast in stone, and they haven't rushed to do that.
Trade negotiations cover everything at once, and it's difficult to tell how they are going to be pushing for the liberalisation of drug regulations and to what extent the Johnson cabinet would actually agree with any changes that would be proposed to the way the UK regulates pharmaceuticals. It's really a central government-led process that's not that democratic and does represent big business, and I think that's why a lot of people get very concerned and anxious around trade agreements.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to see huge changes actually in the Brexit era with regard to the National Health Service, and so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that, when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration. The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
But then again, wait, if we did this, it's socialism. The same people that tried to say that socialism was the same people that was getting thousands off their medications from Obamacare. Them same regular people that was talking crazy about Obama was using Obamacare to get discounts on medications. I know they was. They all was benefiting from it. But yet, you got a problem with socialism. Like, how dare the average man get access to the same amount of benefits as you, filthy rich guy? How dare you? Oh man, that means we're the same. Oh my God, that can't be. No way. It's a classist society. We have to let them know that they're down there and we're up here. Like, it just annoys me so much that it's just stubbornness. It's stubbornness and greed. That's all it is just pure greed. Because there's no reason why, can you tell me why a normal person, how is a normal person not going to benefit from a public healthcare system in America? We talk about normal people. Our taxes are going to go up. Well, would you rather have, okay, your taxes might go up, but would you rather be confident that you'll be able to afford your medicine? To be able to afford your medicine? You don't have to worry about the cost of pills going up every 2 or 3 years. About you can go to the hospital and not think about, oh my God, like when women have babies, they charging them like $10,000 a night per day that they're in the hospital with the baby when they just had a baby. Like, think about it. You're getting charged for being sick because you use the hospital services. You gotta shut up. I'm sick of these people. Like, I'm sick of these people that defend big corporations. Like, when these big corporations would nowhere near defend you. You're just a number on the board for them. Like, why are you defending big corporations as a regular person? What are you talking about? Why are you as an individual defending these big corporations, big pharma, all this? What are you doing? You feel what I'm saying? That's all I got to say. I feel like I talked for too long on this. But let me know how you feel. For all my people in the UK, let me know how you feel about the NHS. Because I'm sure a lot of you have, I understand the not being able to see a doctor right away. That's a big thing, But all in all, like, how do you guys feel about it? But hopefully share this video, man. Because I need this. Hopefully some people see this. Share this video to whoever you share it to. Hopefully some people see this and they understand that the United States, unless we get back to public health care, it's always going to be a problem. It's always going to be a problem. But anyways, I'm out, man. Leave a like on the video. Hit that subscribe button. Turn on my post notifications if you haven't already. Please be safe. Stay on the grind. Have a great day. I'm out. Peace.